our diet as a society is, in my opinion, is the single greatest contributing factor to the chronic health
I would
epidemic,
say
the
that's
diabetes
100%.
epidemic, the obesity epidemic. If we eliminated the ultra-processed foods,
Yeah.
that alone would do
Yeah.
so much.
It does.
You're Dr. Mark Hyman, I'm
Yep.
sure you're familiar with him, and he has said that 70%-ish of people with type 2 diabetes can be cured with diet alone.
100%.
Yeah.
I tell my patients all the time, I'm like, make me take you off your medicine,
Right,
please. I
right,
would love
right,
to. It's like
right,
it's a
right.
good day for me when I'm
Yeah.
like patients come back and
Mm-hmm.
you know, for whatever reason they're
And
like exercising now and they've
that's
changed some
great.
things at home, and I'm like, oh my gosh,
We're
look
done.
at this, man.
That's awesome.
You're not a hypertensive anymore. You're
Right?
not a diabetic anymore. How
Yeah,
cool is that?
that is cool.
Yeah.
And you know, that's, I don't want to sound like a kiss ass, but that's one of the things I love about you in your practice is that you don't want to just throw a medication at somebody,
No.
right?
Yeah. I hate taking pills. I hate
right,
prescribing pills. I know that
right.
they have the role,
Mm-hmm.
undoubtedly, but I think honestly, there's so many medical conditions that we can treat by doing a more natural
Right,
approach
right.
to managing your health.
And those approaches address the root cause.
Yeah.
Where medications, for the most part, usually are just kind of going after the
Yeah,
symptom
and
or
I
the
mean,
manifestation.
even statins. I mean, we
Right.
have we've been using statins for years, but
Right.
from a primary prevention standpoint, which means, you know, we have a patient who's not a cardiac patient, a
Okay.
labeled cardiac patient. You know, we don't have any long-term data, right? Like
Right.
5 years or less. That's kind of the typical.
Mm-hmm.
I mean, it's not a reason to withhold statins where it's
Right,
appropriate.
right, sure.
You know, that being said, you know, it's what it is. You
Right,
know,
right.
secondary, we know that there's very clear benefit when we have a patient who has had a heart attack or something like that.
Sure. So they've kind of established the fact that they're
Absolutely.
in a subcategory that
That's
really has to be
correct.
more aggressive with their treatment.
That's right.
Okay. So we were talking about medications and different ways we could potentially be treated without a medication. So
Mhm.
there's lifestyle things we can do, for example. What would be some examples of things I can do to treat my cholesterol and not take a pharmaceutical?
I think I try to simplify it as much as I possibly can for
Right.
myself, for my patients. I
Right.
tell them 3 rules, like for life.
Right.
Colorful food,
Okay. Good.
portion controlled,
Right.
and move. That's
Move.
it.
Right.
Literally 3 things.
Right.
Because I feel like over the course of my life, you know, when I've been on diets, quote unquote, like all I think about is food. I think
Right.
about how hungry I am. I think about what I'm missing out on. And it gets cumbersome. I'm not going to weigh food. I'm not going to read labels for the most part.
Right.
And, you know, I try to stay away from processed food. My husband is a super amazing cook.
Yeah.
And,
Nice.
you know, his family's from Spain and they don't eat processed food. We don't use a microwave. I mean, we're just,
awesome.
we try to keep it as simple as
Right.
possible. And
Whole
I think
food, whole food,
foods,
right?
and,
Whole foods.
and people just don't cook for themselves
Right.
anymore. You know, it's like you don't have to cook some, you know, crazy
Right,
meal, but
right.
making it as simple as possible, as
Yep.
colorful as possible. I think that's
Okay.
the easiest,
I like that.
simple thing people can
Right.
take away from
Right.
it. And I have a couple patients who are like,
Oh my
not doing a
gosh.
statin.
Okay.
No matter what you tell me, I'm not doing it. I'm going to go green. I'm going to do everything
Right.
that I'm supposed to do, quote unquote. And I mean, it's really considerable the impacts that people can make just doing
Wow.
those basic things.
So you can have plaques
Yep,
from a lifetime of badness.
correct.
And they can actually improve.
They
and go,
can. I mean,
wow,
you know,
that's-
it's
I
kind
didn't
of a
know
risk
that.
you take, right?
Right,
Because statins,
sure.
you know, statins, what we do know that they do for us is, you know, they move the dial on paper. Okay. So they reduce your liver's synthesis of cholesterol. That is what statins do. Okay. And the other thing that statins do is if you have a plaque on the inside of a vessel, what it does is it makes that plaque, the top of it, kind of hard. And I know that sounds weird, like why the heck would you want that? But in a heart attack and a stroke, what happens is those plaques rupture, right? And so all the stuff in your body goes there to fix it, right? But they're not actually fixing it. They actually plug the vessel, right?
Okay,
And so that's the other role that statins play that is very unique to statins.